helpful. Yeah.
All right, I'll let you go at it. Thanks, Mary.
Okay. Okay. Everybody's on. So this talk is for you all just to kind of start thinking about what you want to look for in a job, and things to just kind of consider as you're getting through your year. I know that Tyler has already found a job post-fellowship. How about the rest of you all? Where are you at with things?
I'm trying, but nothing so far.
Yeah, still on the hunt.
Okay.
Yeah, same.
Okay. Okay. So just kind of thinking about like what you're looking for, and Tyler, you too. I mean, because even like when you find a job and you're working, it's never really what you think it's going to be. So just thinking about what you want and what you don't want, and kind of making a list of prioritizing those types of qualities. A couple things to just think about are pay. So if you go into academics, or you go follow like more private practice, or you work with an orthopedics office or a primary care office, there's different pay scales, and then also different regions of the country. So you can look at different like national databases like AAAP or NGMA, and those are stratified by 5 geographic locations, and then also gives information for like starting salary and then so many years out, or if you are following an academic plan, your salary should be linked to your academic title. And then that's also kind of defined by, which department hires you. So just knowing that type of information is important. With that, I think looking at your work-life balance, like whether type of hobbies or interests or personal goals do you have outside of your career, and how are you going to support those types of things in addition to, progressing through your professional life, and just kind of keeping that in mind as well. Seeking out different clinical opportunities, sports coverage, public opportunities, service, presentations, education, things like that, and just like what of those things are nice for you to have and what things are essential. And then it's nice to also talk to whomever's important in your life, so they're kind of also on board or can give you their thoughts about how realistic or detrimental those types of goals can be. So just some things just to think about, like what do you want to do, where, what setting. We talked about like private practice versus being in a primary care office or orthopedic office. And I think part of fellowship is nice because there's like, we're obviously, academically based, but you work with a lot of different individuals who've come from different backgrounds. And quite a few of us have worked at other locations, talking to even like Lou Leone, and seeing what it's like to be in a private practice with sports focus type of setting is helpful. And then just talking to people about like how their clinics are balanced, how many patients they see a day, and what would be realistic for you, and what are just other things to consider. When you go to, like you already went to your fellows conference, and then hopefully you'll go to another conference besides AMSSM or AOSM this year, or even in future years. When you're there in person, you can talk to a lot of different people as well. And it's a nice opportunity just to kind of bounce ideas off people and to see like, what do they do in their area of the country, and like what type of compensation do they get for sports coverage, or being the sponsor of a program, or the team physician for a program, or things like that. And then also identifying like what type of people you want to work with. Like I know like when you're choosing your residency plan, trying to identify like, do you like the people that you're working with, or do you actually like the field of medicine that you're trying to pursue? And sometimes trying to differentiate, like, do you like a certain area of medicine or a certain type of practice because of what you're actually doing day to day, or is it because of the type of people that are there? And so it's important to know that too when you're interviewing or talking to people or emailing back and forth, trying to get a little glimpse as to what people's personalities are like, because again, your job is never going to be like exactly what you think it's going to be like, and the people that you work with can certainly make or break a program based on just your day in day out interactions with people. So those are just a couple other things to just kind of think about. We talked a little bit about this. Culture again is really important. Looking at not only like how personalities are shown in interactions, but also just what the culture's like. Like, is it competitive? Is it collaborative? Do people work together? Like, what's the workflow? Like, are you driving to 3 different locations every day and then going to, another sporting event or athletic training room? Like, what's your day in, day in, get out going to be like? And then also just knowing like what kind of power do you have, or what type of responsibilities or autonomy do you have in kind of changing or designing your practice. Like sometimes when you work for a really big corporation, like university hospitals, like you're just an employee, and having say with whom you work with, or how your schedule's set up, or what type of people are part of your staff is different than if you're working at a smaller practice, or if you have a certain title of administration, you might have a little bit more say in these types of decision making. And that can definitely change like how your workflow is, how you perceive your satisfaction with your job, and again, like what your day-to-day conflicts are, or problems arise and how they're solved. So work hours in a week can definitely fluctuate. Typically, there's not like after hour call or overnight call with sports medicine, unless you're also working with like a primary care based academic position. So like if you're, family practice and so many percent sports medicine, or like in our case, like pediatrics and partially sports medicine, if you're gonna, then take call for patients who are in the hospital, or then you have to also, cover whatever responsibilities, like knowing those types of things changes how your work week flows. Expectations of how many patients you see in a day, like obviously when you're rotating with some of the orthopedic surgeons, they might see up to 40 patients a day. And that might be standard for some places versus, I think 20 to 25 is probably a little bit more acceptable or routine for most practices. Knowing if you're going to see patients every 15 minutes or every 20 minutes, and just how that's going to kind of work out. What types of diagnoses you might see. So if you want to do like a lot of ultrasound and injections, or 10X, or procedural based, or you'd rather do more like primary care sport medicine based stuff with like well-child checks, or not well-child checks, like sports physicals, or more like chronic issues like energy deficiency, overuse injuries, things like that. If you like fracture management and you want to make that part of your practice, but also just kind of realizing like based on your background, we all have different training, and accentuating your specialties is important, because you want to be able to kind of market yourself amongst your peers, so that not only you retain patients, but you also remain attractive to your employer, and you can argue for, why you're a value, or why you're an asset to your employer. We talked about life, like living and cost of living and stuff like that too. Okay, so I think the overall arching theme with all this is that you really want to think about looking for a job differently than how you did for matching for residency and fellowship. So you go through training, and you ask people for letters of recommendation, and put together your personal statement and things like that. And then, you go to interview at all these different places, and then you kind of leave it up to the match gods. And I'm sure that you've kind of seen with Zoom interviews and everything just this year with the couple days that we've had, that it's a lot of people, and your interactions are very short. When you interview for your job, it's very routine that you speak with someone on the phone, you have correspondence via email, and then you may have 2 to 3 in-person interviews, or maybe one of those might be Zoom, and then you have a few in-person interviews before things are really settled. But just having an appreciation that it's a completely different process, and that you should have a different point of view is important. Speaking to a couple different of your mentors about how they went through this process, and what they learned, and what they wish they had known along the way is important. So that's one of the reasons we put this talk together, is so that you all feel like you can approach us and talk with us, and just kind of start thinking about things, and identifying like how jobs can be different, and what you really want to try to look for. So your mentors can help give you some insight, and hopefully help save you some time with just how to navigate the process overall. They're also a good source for networking, as are these different conferences and any opportunities you might have, like working on national committees or being involved with like fellowship groups. It's just a good way to network with people and just kind of find out like what opportunities are out there and how jobs differ from one another. And then it's always important to know like how to leave an opportunity as well. So before you even get started with looking for your job, or you know, for Tyler who's already kind of landed their job, you always want to think too, like if a job has like certain things that you like and certain or it has certain qualities that are beneficial to you, it's also going to have things that you don't like, and you're going to change as you pursue your career path, and you're going to have different focuses and different priorities as you continue to develop as a physician and as a person too. And so planning an exit strategy is important. So leaving any opportunity, whether it's during the initial phase of emailing and talking to people, or after it's having a few in-person interviews or Zoom interviews, it's good to know like how are you going to plan your exit strategy so that you still leave on good terms. You want to be, you know, always respectful, timely, because you never know when that opportunity might present itself later. And then also just knowing sports medicine in general is a pretty small community, so people talk. And if you are, you know, in any way perceived not being respectful or a team player or just things like that, like word does travel. And so just making sure that you keep that in mind as you're communicating with people. And then if you're already, you know, in that position where you're working and you're part of a, you're employed and maintaining a job, you know, when you decide that you want to start looking for other opportunities, like trying to design how you're going to leave that job is important. So it's just always good to think about an exit strategy before you even get into a commitment, so that you can kind of make plans and change those plans as things develop. So before you contact anybody and before you reach out to any organization or start talking to any type of recruiters, you want to make sure that you have your paperwork together. So Suze had sent out an email a while ago with your CV, and I'll send out another form after our talk today. This is used as a way to really describe like what you've done. Even though sports medicine has been around for quite a bit of time now, there are still organizations and hospital groups and programs that don't know specifically what sports medicine is. Even people that we work with here still don't understand what we do. And, you know, we end up with these people on our schedule who aren't really appropriate for us. So your CV is a way for you to explain not only your training and your certifications and, you know, all the things that you've maintained, but also what specifically you've done during your residency and during your fellowship that makes you unique as a sports medicine candidate. So, you know, the games you've covered, the lectures you've given, the didactics that you've partaken in are things that you should list, and we'll be glad to kind of go over that so that you're able to formulate that in an organized manner so that people can see what you've done and why you're a desirable candidate. Your references, you obviously want to ask people before you list them as a reference, and you want to ask people who you know are going to say nice things about you. You know, if you've had a bad interaction with somebody, even though they may be, you know, a really respected person in the field, or you think, you know, you really admire them, but you don't think they're going to say the best thing about you, that's not who you want to ask to write a letter or to speak on your behalf to somebody else you're talking to. You know, and feel free to ask other people too. You know, some people don't write letters as well as others. Some people just don't come across as well when they're talking to other people. And so, you know, talking to your cohort and the previous fellows that we've had is a way for you to kind of know like who's someone to ask, you know, and how should I navigate this process. One of the things that Suze does great at AMSSM, and we've done a couple times at AOSM, is to get the previous fellows together so that you all kind of know each other and can lean on each other as well through this process. Because even though you go through this now, you're most likely going to go through this again. And so it's a learning process, and, you know, having a little community that you can talk to about like what you like and what you don't like and what you've been through is a nice way to kind of teach each other how to navigate this. Because this is definitely the business side of medicine that none of us have been as trained in as we have in medicine itself. So another way to kind of go through contacting people is either through recruitment or through, individual name dropping, or again, just kind of talking to people. Some of the networking or social media platforms like LinkedIn or Doximity are ways also to kind of find out what's out there and make connections with people, and just kind of talk and find out, what job positions are available. I will warn you that recruiters are definitely the least knowledgeable in general in being able to describe a position. And so when you talk with the recruiters or when you communicate with the recruiters, just knowing that they might not be the best person to describe specific responsibilities or, lay out a position. And they may not be the best reflection of what the program's actually like, or what the office staff is like, or your peers would be like. But they're definitely still somebody that you want to be respectful to and communicate with, and be they can be a liaison to you. So making sure you get your information to them in a timely manner, you respond to them in a timely manner that can all reflect on you, even though they may not be giving you the best information that satisfies the questions you may have. It's kind of frustrating, I think, sometimes. Okay, I think that's pretty good. Okay, so when you kind of get ready to start interviewing, just realizing again that how you present yourself is going to be the way that people remember you. So those first impressions are very important. So when you're, when you're communicating online or communicating on the phone, making sure that you make time to formulate your sentences correctly and proofread to make sure you're not misspelling. And then like when you're on the phone, like making sure you're in a quiet area and that you don't have stuff going on in the background so that you can actually devote attention to whomever you're talking to. Things that are pretty common sense, but you might forget when you're in a busy year of fellowship trying to get everywhere and get all your ducks in a row. Even if you're talking to somebody who is the most boring and dry person, make sure that you are very excited and that you show your interest and try to sell yourself every time that you talk with somebody. Again, like knowing like what type of people are there and what they're actually doing. Those types of questions are going to be good for talking to actual individual clinical people, but trying to feel out like what the program's like. You can talk with the recruiter about that, and you can always put your best self forward like during all these processes of talking to other people. When you are talking with like the individual recruiters, like asking like why the position is available, why people left, if there is an open position that's on a new position, or why the program is expanding, are nice questions to kind of think about. Finding out what the goals are, or the aims of the company or the program that you're evaluating. And then when you're given a list of the people whom you will be talking to, or even when you look up the hospital or the business organization, look up the individuals who work in that field and look up their CVs. A lot of times you can find those online and find out what their interests are. Like you could even read if they've published or if they've given talks. Like sometimes you can find their talks online, and it's just a way for you to kind of find out like what those individual people's interests are. It tells you a little bit about like how the company is situated or how it's formulated, so that if there's a lot of people doing research or a lot of people doing presentations like nationally or locally, or they have lots of programs with different athletic organizations, it allows you to know how that program is different from another program, what their values are, how they actually then like tackle their goals, or how they then follow through with the commitment of what their aims are, and then also what the interests are of the people who are there. It also gives you topics to talk about. It's always kind of weird when you talk to people that you've never met, and for some people it's really easy, for some people it's not, but there's always some awkward times. And so if you know more about the person and you get them talking about themselves, they're always going to think more about you, even though they're just talking about themselves. And so, asking them like what their interests are, what they've already presented on, without brown nosing, you say like, oh, I, looked at your lecture and blah, blah, blah. Like actually like just bringing up those topics, like it gives you like a common thing to talk about. And also, again, just kind of lets you evaluate the program from kind of a forest through the trees level. And again, like talking to other people about like when you talk to somebody, like a lot of us know other people who are in the field, and everybody always puts on this, day of like bells and whistles like we do when we interview or follow applicants. You put your best foot forward, and the program's supposed to put their best foot forward. So, if there's things that like you just kind of pick up on that are either red flags or subtle flags, ask other people, like, what's this person like? Like, what do you know about this person? And most people should be, pretty honest with you. Other things to think about are just benefits that come with the job, looking through all the type of insurance, retirement contribution, like even though you're just starting out with your job, think about retirement is important from day one. Knowing what type of malpractice coverage you have, and then also like how many vacation days you might get, if you get CME days, or if you have funds allocated for that, and just knowing that those things can change. And so when you get a contract, like going through all that fine legal jargon is important so that you really know what you're signing to. And then also knowing like when you're eligible for any type of disability. Like I know that like for females, knowing when maternity leave might be eligible, but paternity leave is also something that's offered for fathers. And then like if you have any type of medical issues that come up in your lifetime, making sure you have disability and what type of disability you're eligible for is important. So we've had a lot of this, like just thinking about day-to-day things. And again, like I'll send this out so that you all can kind of go over it again and again. And just kind of identifying like why it's important and what it might mean to you. And then again, like how to prioritize like all this stuff. Like obviously no job is going to have everything you want, and no job is going to be perfect every day or in general sometimes. But just again, like, can you prioritize, some of these qualities and then leave out other qualities? Or if not, like, how do you find a place that offers the most of what you want? We've learned a lot about technology this year, so switching over to Epic for us, recently has been challenging. And when you guys came in, you got to go through Sunrise and struggle with that too. So you can see how just like different things like having access to electronic medical records, how you have access to radiology, like when we have patients go to a different facility and, we're trying to track down imaging or radiographs or MRIs. If you have staff who then helps you to do that, or if that falls on you, if you have access to, ultrasound, and if you can negotiate purchasing a machine in your contract, or how many, clinics will have those types of machines for you. These are things that we've talked about in years past with fellows, and, you can definitely negotiate for these types of things so that you have access to do what you want to do. Scribes are great. So, we don't have scribes here in our department, but I know some of the orthopedic and even primary care practices have scribes. And I think that your day definitely changes if you have, somebody doing all your documentation for you. So just a couple other things just to kind of think about, when you're thinking about your day-to-day. And then compensation is big. Like I know that we all go into medicine. Well, I think a lot of people go into medicine for altruistic reasons, but you do want to get paid for what you do. And you also want to know how to document what you do. Like you want to make sure that you're, again, advocating for yourself on a daily basis. And so when you're charting, I know charting, is a big time suck, but that's the, type of information that's then needed to qualify how you bill. And so a lot of places pay you based on your RVU generation. And so if you're documenting properly, you're able to generate proper RVUs to qualify, what you're doing with your patients. And then your compensation is based on the type of RVUs you generate. So if you are doing things that are more procedurally based, you're going to generate more RVUs than if you're doing things that are more diagnostic based. And so again, kind of setting up your day and setting up your patient population or your clinic time to support what your interests are, and what type of compensation you would like to achieve is important. And then knowing like usually when you sign, you have a buffer that you don't have to meet certain qualifications or parameters in the first year or two, I think is pretty standard, but making sure you know that, and then know who you're compared against. Like you should be compared against your peers that are in your level of expertise and experience. And then, you should have a plan as to how you're going to become more productive. So knowing like how your employer is going to market you, whether you're going to meet other providers or programs that are going to refer to you, if the athletes that you see in training room are those that you can also bill for, or do you get some type of compensation for doing teamwork outside of your clinic time? That's important because it all kind of comes back to your review process. So review processes typically occur annually, sometimes semi-annually, but knowing who does that review process, like is it actually somebody who knows what you do so that you're being evaluated properly, are just kind of things to think about. And then knowing like, if you achieve your markers, are you then eligible for a financial bonus or some other type of bonus? Are you, eligible for some type of promotion, or do you then, one of the fellows last year, like once he met a certain productivity marker, he would then get a scribe in his clinic. So kind of knowing like how are they going to support you so that you can do what you want to do and you can be productive and, be clinically generate whatever type of productivity you want clinically, but then how do you then progress with your longevity in your employment? Again, marketing is important. So marketing yourself to your patients, marketing yourself to your, potential employers, marketing yourself to your peers is something that you really should kind of get used to doing, and just kind of understanding that you will always rely on other people to refer patients to you in sports medicine, because sports medicine is a kind of, for the most part, single diagnosis management, that once patients are have recovered from whatever injury they have the opportunity to go see somebody else, or even after they walk out the door, they have the opportunity to go see somebody else or come back to see you and your peers also. So knowing like who's going to refer to you, like, and then how do you get to know these people? So if you're breaking into a new place in the country that you've never been, or, you're just going back to, where you lived before or someplace you trained before, you're still going to get to know that community in a different aspect because you serve a different purpose. So, getting to meet ER doctors, urgent care physicians or providers, school programs, community programs, and then, reaching out to them on a routine basis is important. And then knowing whether or not your employer offers that to you, or do they support you in doing that? Like, do they give you time to do that? Do they support if you're going to go to a conference and present, your research or a case presentation, or, do some type of networking? Like, are you given time to do that or funds to do that? Or, are they willing to be nurturing in your development, not only, professionally, but also for productivity? If you have academic aspirations, these are the things that you might want to consider, like how do you work with the residency program, fellowship program, other primary care or specialty care departments, who in education do you talk with? And these are people that you might interview with, if you go into an academic position or if you're interviewing for an academic position. So just knowing how you would interact with these people and how they would support your goals in obtaining employment. And then again, like different specialists, so different hospital groups work either really closely with primary care departments or orthopedic departments, or they don't. And knowing what type of relationship is set up and what type of relationship you could cultivate if it's not already established is important. Getting to know these other people whom you may refer to or whom may refer to you, how they interact, and just what type of communication or opportunities for program development are present for these different departments. And then if you have physician extenders either in your department or whom you may hire or whom may work with you is, can be very different from job to job. Other things to think about outside of clinical work, if you have research interests, if you have interest in writing grants so that you can support whatever development or program, may come with your employment. If you have a special interest with certain populations or certain procedures, is your employer willing to support you in establishing these types of programs or developing these programs if they already have something established there? And then again, education, we talked about that a little bit too. Other ways that you can get involved and that you should think about getting involved, even if you're not really interested in these types of things, are how to also be what's considered a good citizen. So working on committees in the hospital, doing outreach programs with the community, advocating for, certain patient populations or physician groups, or the hospital or the department you're working for, working on quality improvement, and then recruitment is just important so that you can show along the way, like during these evaluation periods, that not only are you invested in your clinical performance, but you're also a valuable employee or an invaluable person because you're also providing service in different areas as well. And it also allows you again to kind of create networks and referral bases and see what other opportunities available, because like as you develop as a physician or kind of pursue your career, your interests will change and things will kind of come across to you, or you might find other things that you want to pursue. So it's just good to get involved in different ways. When you go, typically not, I wouldn't say it's the first time. Sometimes it's the first time you go out in person, but definitely by the second time you go out in person to interview, they typically take you around the community with a real estate agent or somebody who represents the community. And if you have kids or if you're married and you plan to have kids, they might show you the schools. Everybody needs to live somewhere. So usually they show you like what types of different communities are out there. And typically it's like kind of like where the physicians live. But like if you have a certain community you're looking for, like asking like if you can see like a certain area or, just to kind of show you like what else is around there besides the hospital. It's also a good thing for specifically for sports medicine to see like what type of sports programs are out there. Like if there's professional programs or collegiate programs or, high school programs or just community programs, and where those are in relation to your clinic, what the weather's like, because certainly certain weather and climates can support different sports than what we have here in the Midwest. And then, looking at the parks and outdoor systems is good too, not only for your career, but also for your interests and other things you might do with your family or personal life, and then annual or activities just in the community. So we talked a little bit earlier about like an exit strategy. So just, thinking like whenever you start a relationship with any business individual, just how to say no, when to say no is important to think about. When you first reach out to a program, typically writing a letter of intent is, you write a cover letter for your CV. Your letter of intent is something that the program gives to you that you look over before signing. You might want to negotiate some terms. And so talking with either different people here on faculty or some of your other mentors or peer groups is a good thing to do so that you can find out like what other people consider. This is probably the first time for most of you that you're going through a big job negotiation process. And typically the most potential you have for job development, future opportunities, and finances come with that first opportunity in contract negotiation. So, this is a big deal, and taking time to really process and understand what is being told to you and what's in writing is really important. Making sure things are in writing and that you have that proof to show people later that that's what we talked about is very important. And then just, talking to other people to find out what other things you consider. you should consider or not consider is just kind of standard for the game. Some people will hire a lawyer, like a contract lawyer, to discuss these types of things because it's all in legal jargon and takes 20 pages to say something that should just be, bullet point in our medical minds. So, having somebody like translate what's written down for you is something to consider. A lot of times they'll give you a trainee discount or like a fellow discount so that you're not paying the full cost for a lawyer to look at your contract. But not everybody goes through that, but it is an opportunity to just kind of learn what you're looking at. So on your interview day or days, make sure that you arrive early and that you are presenting yourself physically very, nice and professionally, thinking about like what you should wear. Most times people are a little bit more conservative than, dressing in really bright, provocative types of things. Your appearance is, a lot of your impressions. So even though you've been through 20 years of training and have an impressive CV and have, really articulated all your wonderful things that you've done, we're very superficial people in general, and we just, judge people based on how they look. And so just accepting that as part of the process and making sure that you dress to, the nines is really important so that you're able to put your best foot forward. If you bring your spouse, make sure that your spouse is on board with being the spouse and just being like kind of your support person over, to the side of you. Like they're not supposed to detract from you being the center of attention that day or in any conversations. Their role is to be supportive. And if they have any opinions that are not, going to be received well, they're supposed to keep those to themselves and then talk to you about that later. A lot of times your spouse is invited to come out, and I would say if you don't bring your spouse, if they're invited, you should make sure that there's a reason that they're not coming. Like that could be something that's perceived as you not really being interested in truly interviewing for a place. So just make sure you have that conversation with your spouse or your significant other as well. And then I just put down like a bunch of sample questions to practice asking and practice answering and thinking about. And certainly, like, you don't have to go through all these, but it's just a way to just kind of get your mind thinking about what's important and different topics to consider and how you might bring these into discussion or how you might answer them as well. And certainly, like going through some different mock interviews can help you just kind of make sure you're coming across naturally, but also, that you have some good answers for this. So I'll make sure I send this out for you all to kind of peruse. And then if, along the process you want to talk with us, we're happy to talk with you all and just kind of give you our ideas. And, if you get to the point of contract negotiation or offer, we'll definitely give you as much information as you would like so that you are able to make an educated decision when you get to that process. Does anybody have any questions?
I did have a question. You talked about making sure that we get paid according to our level of training and expertise. How do you, and if you do, how do you ask, like, what other people in the practice are getting paid?
So you don't ask that the first interview, for sure. There's a couple different databases you can look at. There is the AAAP and the MGMA. Those are national databases that look at private and academic positions with different titles and levels of or years of experience. And it is, again, noted for regions of the country. So it's divided into 5 regions of the country. You can search it, usually to actually find like the full data, you have to pay for it. So that's one way to look. You can, kind of ask information, ask like how many patients people see, what's their review process. You can ask about like CME money or vacation or program development money, and to kind of get an idea as to how their financial compensation is set up. But typically, like you ask that after at least a few interchanges and before that letter of intent is sent out. A lot of times you can ask people who, have worked there, or, ask some other people, what their compensation's like. They might be, forthcoming with it. Sometimes they, tell you right off the bat, like, this is what you'd start at, and this is when you'd be eligible for a bonus. And if they bring it up right away, you are welcome to talk about it. But it's not something that you usually want to, come right in the door asking about.
Gotcha. Thanks.
Mm-hmm. Okay, guys, sounds like you don't have any other questions. Well, certainly, along the process, I'm sure you'll have questions, and please don't be shy. We're happy to talk with you all as much as you like when you're